Good morning, one and all. I am Professor S.Pappy Yuvarani from Department of Obstetrics and Gynecology, a faculty from College of Nursing. Today, I am going to teach you about anatomy of female reproductive system. So, what are we going to see in the female reproductive system? We are going to see definition and the terms and how to identify the female external reproductive genital organs and the structure of the bony pelvis and functions and structures of the pelvic floor. Coming to introduction, in all human beings, one of the processes is human reproduction, in which the male and the female organs differ anatomically and physiologically. The female reproductive organs are divided into external and internal organs. So, external female genital organs are divided as mons pubis, labia majora, labia minora, clitoris, vestibule, and perineum. Altogether is called as the external female structures. So, one by one, let's see. So, the external genitalia is otherwise called as the vulva. We can see in that mons pubis, clitoris, labia majora, and labia minora. Mons pubis. Mons pubis is nothing, a pad of fat overlying the symphysis pubis, and it is covered by the skin and the hair. Next is the clitoris. It is an erectile carnivorous structure below the symphysis pubis, formed of small glands and two carpora carnosa. And next is the labia majora. Labia majora is nothing but it is covered of two skin folds, outer skin folds, raised by an upper lying fat and passing from the mons vernix to the perineum. The outer skin covered by the hair, while the inner medial surface is smooth, hairless, and contains sebaceous and sweat glands. Labia minora. Labia minora is of two thin folds of modified skin situated medially to the labia majora. Next is the hymen. The hymen is the membrane situated that is 2 centimeter from the vestibule that terminates the external from the internal genital organs and partially closes the vaginal orifice, that is the hymen. And next is the Bartholin gland. The Bartholin gland, it's otherwise called as the greater vestibular gland. It is bilaterally compound racemose glands. It secretes mucus during sexual excitement. Situated deep in the labia majora at the junction of the posterior and the middle thirds. Its duct is 2 centimeter long and it opens between the hymen and the labia minus. Next is the vestibule. Vestibule is the area between the inner folds of the labia majora and the foreshed structures that open the vestibule are ureter, the Bartholin glands, and the vagina. Next is the vestibular bulbs. It is the longer mass of erectile tissue that lies on the either side of the vaginal introitus. Next is the external ureteral meatus. It is a triangular sheet in the anterior part of the vestibule below the clitoris in which the ureter opens. Next is the Skene's duct. They do blindly ending paraurethral tubules which opens in the floor of the ureter and a few millimeters from the external ureter meatus is the Skene's duct. This is the external genitalia. So, what is the blood supply of the external genitalia? So, the arterial supply is the internal pudential artery, the terminal branch of the anterior division of the internal iliac artery that ends as the dorsal artery of the clitoris. Branches from the femoral artery supply the anterior part, superficial and deep external pudential arteries. Next comes the venous drainage. The venous veins draining the vulval from the venous plexus, which drains into the internal iliac veins. The venous draining the clitoris joint vagina and the vesical venous plexus. The lymphatic drainage of the nerve supply. The lymphatic drainage to the vulva is from the skin and the appendix to the superficial linguinal lymph nodes to the deep linguinal and femoral lymph nodes, of which the lymph node of drains the clitoris directly. Next, the nerve supply of the vulva. The vulva is supplied mainly of the pudential nerves, that is S2, S3, and S4. Additional sensory nerves are supplied from linguinguinal nerve, the genital branch of genital femoral nerve L1 and L2, and the posterior cutaneous nerve to the thigh. That is the nerve supply and the lymphatic drainage to the vulval area. Next is the internal genitalia. Till now we have seen about the external genitalia. Now we are going to see about the internal genitalia. The microvascular tube from the vulval to the uterus lined with the squamous epithelium containing external and internal organs of reproduction is the internal genitalia. The length of the internal genitalia is the anterior wall measures about 8 to 9 centimeter and the posterior wall measures about 8 to 10, 11 centimeter. Next is the vaginal fornix. The vaginal fornix, the cervix projects in the upper blind end of the vagina that forms the pouch of Tuxlex. That is the vaginal pouch around the cervix, and it is divided into four fornix, two lateral fornix, anterior and the posterior fornix. In that, the posterior fornix is the deeper fornix. Next is the anatomical relations of the vagina. So, the anteriorly the vagina, it has upper one third of trigone of urinary bladder, lower two third of ureter, and posteriorly upper one third of peritoneum of pouch of Duxless, middle one third of ampulla of rectum, lower one third of the perineal body, and laterally the lower end of bulbocorneous muscle, that is the vestibular bulb, and the Bartholian gland, 1 centimeter above the orifice, that is urogenital diaphragm, 2.5 centimeter above the orifice, that is levator ani muscle, with the pelvic fascia, and above it, the lateral fornix gives the attachment to the lower part of the cardinal ligaments. The ureter passes through the cardinal ligaments 1 centimeter lateral to the vagina. That is the lateral connection to the vagina. Next is histology of the vagina. When you go to the histology, that is the cross section or the cut section of the vagina, the vagina will be looking in the head shaped, the approximation of anterior to the posterior vaginal walls. It is formed of three layers, that is mucosa, mucosola, and adventitia. Mucosa, it is formed of squamous epithelium without glands, whereas mucosova, which is fibromuscular with some fibers from the levator ani inserted into it, and adventitia, which is fully connective tissues continuous with the paracarpus. The blood supply to the vagina. The blood supply is mainly through the vaginal artery, that is from the internal iliac artery, that is arterial plexus, additional artery from the middle rectal artery, that is from internal iliac artery, inferior rectal artery from the internal pudential artery, venous drainage. The plexus around the vagina, that is the vaginal plexus, drain into the internal iliac vein by veins that accompany their corresponding arteries. That is the blood supply and the arterial supply and the venous supply to the vagina. Next is the lymphatic drainage and the nerve supply. The lymphatic drainage of the vagina is through venous plexus, drains into the internal iliac veins, lowers one third of the linguinal lymph nodes, upper one third follows lymphatic drainage of the cervix, middle one third drains in the upper and lower direction. Nerve supply of the vagina. The pudential nerve gives sensory fibers to the lower vagina. This is the lymphatic drainage and the nerve supply to the vagina. Next comes the uterus. So uterus is a pear-shaped hollow muscular organ, measures around 7.5 into 5 centimeter wide into 2 centimeter in the longitudinal transverse and anterior posterior diameters. It is slightly larger in the multipara than in the nullipara. This is about the uterus. And then the divisions of the uterus. The corpus uteri, that is the body that lies above the internal os, is the body of the uterus. Next, the corona. Choreo, this is the area of the insertion of the fallopian tubes. Fundus, that lies above the incision of the tubes. There are three structures attached to the corona, that is round ligament anteriorly, fallopian tube centrally, and ovarian ligament posteriorly. Next is the isthmus. The isthmus is an area that is 4 to 5 in length that lies between the anatomical and the internal os above and the histological internal os below. It is lined by the columnar epithelium and fluvial glands. Next is the divisions. The divisions is the cervix, that is an elongated lower part of the uterus, measures about 2.5 centimeter to 3 centimeter, divided by the vaginal attachment into the supravaginal portion above and the vaginal portion below, that is portio vaginalicus. The cervical canal is the cavity that communicates above with the uterine cavity at the internal os and below with the vagina at the external os. The cervical mucosa has two ridges, that is the anterior and the posterior ridges, from which the transverse ridges radiate to form the orbitrovitae uteri. This is above the cervix where it is connected to the uterus. Can you see in this picture? And then coming to the position, you all know what is the position of the uterus. It is in a shape of antiverted and antifluxed. So why it is so? With an external os lining at the level of the ischial spine with the support of the cervical ligaments and endopelvic fascia and pelvic floor, that is pelvic floor muscle, that is levator ani muscles. Why it is antiflux antiversion? The uterus is inclined anteriorly to the axis of vagina. That's what it is in the shape of antiverted. And why it is antifluxed? The body of the uterus is bent forwards the cervix, so it is in the shape of antiflux. So the position of the uterus is antiverted and antifluxed. Can you see in this picture? It is clearly seen the uterus is in the shape of the antiverted and antifluxed in position. And next, relation to the body of the uterus. Then it is anteriorly connected to the bladder and the vesicouterine pouch. Posteriorly, the pouch of Duxless. Laterally, the broad ligament on the each side. And next, relation of the supravaginal cervix. Anteriorly, it has an urinary bladder. Posteriorly, it forms the anterior wall of pouch of Duxless. Laterally, often hinge lateral to the internal os, the ureter is crossed by the urinary artery, uterine artery, that is ureter below the urinary artery. The uterocervical, cardinal, and pulbocervical ligaments are attached to its posterior, lateral, and anterior surface, respectively. What is the histopathology of the uterus? The histopathology in histopathology, the uterus has three layers, that is endometrium, myometrium, and perimetrium. Endometrium is fully covered of mucosa, whereas myometrium is full of mucosola, and the perimetrium is nothing but the covering of the peritoneal layer. Next, endometrium. So in endometrium, it is lined by the simple cubical or columnar epithelium, contains tubular glands. During the microscopic examination, you can see the gland, that is the columnar epithelial glands, show cyclic changes with the menstrual cycle under the influence of this ovarian hormone, that is estrogen and the progesterone. And in myometrium, there are again three layers in myometrium, that is outer longitudinal muscle layer, inner layer, and the inner circular layer. So, in inner layer, it is mainly placed upon interlacing crisscross muscle surrounding the blood vessels. Then the inner circular muscle layer in myometrium. Next is perimetrium. As we know, perimetrium is the layer of the peritoneum. So anteriorly, it is firmly attached to the fundus and the body till the isthmus, where it becomes loose and it is reflected on the superior surface of the urinary bladder, forming the vesicouterine pouch. Posteriorly, it is firmly attached to the fundus, body, and the cervix, that is posterior vaginal fornix. Then it is reflected on the pelvic colon, forming the pouch of Duxless. Laterally, the anterior and the posterior peritoneal covering as the anterior and posterior layers of the broad ligament. This is about anterior, posterior, and the lateral of the uterus where the perimetrium layer covers. Next is the cervix. So in endocervix, it is lined by the single columnar epithelium with the compound racemose glands or cryptus that are liable to chronic infection. It secretes alkaline cervical mucus. Next is the muscle layer. In the outer layer and the inner circular layers are the two only layers present in the cervix. Endocervix, it is formed of the stratified squamous epithelium covering the outer portion of the cervix. The junction between the squamous and the columnar epithelium at the external os is either abrupt or it may be in a form of transitional zone, that is 1 to 3 mm, known as the transformation zone. So this zone is called as the transformation zone. So we have seen about endocervix, muscle layer, and an ectocervix. Next is the blood supply to the uterus. So coming to the atrial supply, the uterine arteries supply the atrial supply that arise from the anterior division of the internal iliac artery in the base of the broad ligament crossing above the ureter, that is often hinged lateral to the suprapubic cervix. So two branches there are present, that is an ascending branch and a descending branch. It is clearly explained in this picture. You can see the two branches of blood supply, that is an ascending branch and a descending branch. Next is the ascending branch. The ascending branch passes upwards in the tortuous manner parallel to the lateral border of the uterus between the two layers of the broad ligament to end up by anastomosing with the branches of ovarian arteries near the uterine corona. The descending cervical branch supplies the lower cervix. You can clearly see in this picture given here. Next is the venous supply. It starts as a plexus between the two layers of the broad ligament that communicates with the vesical plexus and drains into the uterine and the ovarian veins. Next is the lymphatic drainage. Deep and superficial vessels drain lymph from the uterus, the uterine tubes to the aortic lymph nodes and the groups of nodes associated with the iliac blood vessels. Nerve supply to the uterus. So, what is the nerve supply to the uterus? The cervix and the body are relatively insensitive to touch, cutting, and burning. The cervix is sensitive to dilatation, and the body is sensitive to distension. The nerve supply is through parasympathetic nerve, that is S2, S3, and S4, and sympathetic nerve, that is T5, T6, that is motor nerves, T10, T11, T12, and L1, that is sensory nerves. Both reaches the uterus through the branches of inferior hypogastric plexus. Next is the fallopian tube. So you all know what is fallopian tube. So this is next to the uterus, that is, it is two tortuous tubes lie in the free upper part of the broad ligament. So each fallopian tube measures about 10 centimeter in length. They bend immediately with the corona of the uterus. Laterally, they are free outer and curves backward towards the ovary. Their lumen communicates between the uterine and the peritoneal cavity. There are four parts in the fallopian tube, that is interstitial part, isthmus, ampulla, and the infundibulum. Interstitial part, it pierces the uterine wall, very narrow, no peritoneal covering, no outer longitudinal muscles. So isthmus, this is 2 centimeter long. It is straight, narrow, thick walled portion lateral to the uterus. Ampulla, it is 5 centimeter, the widest, tortuous, thin-walled outer part. Infundibulum, 2 centimeter, trumpet-shaped outer end opens into the peritoneal cavity. The tubal ostium. The ostium is surrounded by the fibrae, one of which is long and directed towards the ovary. So the fallopian has two parts, that is four parts, that is interstitial part, isthmus, ampulla, and an infundibulum. Next is tubal function. What are the functions of the fallopian tube? It has an ovum pickup, transport, and production. What is ovum pickup? During the time of ovulation, by the free fibrae they become the ovum, and transport of ovum through the tubal lumen by the peristaltic and ciliary movements occur. The production of secretions necessary for capitation of the sperm, and it provides nutrition to the ovum during the journey by their lining cells. That is the fallopian tube functions. And next is the anatomical relations. It is bounded by the loops of intestine, below by the broad ligament and its contents. Medially, they bend with the corona of the uterus, while laterally they are surrounded by the lateral pelvic wall. The ovaries lie posterior and inferior to the fallopian tubes at each side. Next is histopathology of the fallopian tube. So mucosa, that is endosuffix, arranged into 4 to 5 long ridges that gives rise to subsequently folds or plegia. It is lined by the columnar partially ciliated epithelium, muscular layer, outer longitudinal and inner circular layer smooth muscles. It is thick at the isthmus and thin at the ampulla. And serosa, it is the peritoneal covering. The extrauterine part is covered by the peritoneum in the upper margin of the broad ligament. The blood supply to the fallopian tube, that is the arterial supply, it supplies from the both the uterine artery and the ovarian artery. The venous drainage, Right ovarian veins drain directly to the ICV, and left ovarian vein drains into the left renal vein. Lymphatic drainage, para-aortic directly via ovarian lymphatics, nerve supply, sympathetic from lumbar and parasympathetic fibers from sacral outflow. Applied anatomy, we can feel a tubal pain referred to the tubal points on the lower abdomen, that is half an inch above the mid-linguinal points. And next is the ovary. It is almond shaped, lining in the fossa ovarica on the lateral pelvic wall. The ovary measures about 3 into 2 into 1 centimeter, not covered by the peritoneum. Surface is purely white and corrupted by the effect of the monthly ovulatory activity. Can you see there in this picture, that is the ovarian ovaries that is connected with the fallopian tube, ovarian ligaments, and it is connected to the interstitial part of the tube. And next is the ovarian attachments. So there are three attachments of the ovary: the mesovarian, a peritoneal fold that suspends the ovary to the back of the broad ligament; the infundibulopelvic ligament suspends the upper pole of the ovary to the lateral pelvic wall and carries the ovarian vessels, nerves, and lymphatics. Next, the ovarian ligament that attaches the lower pole to the corona of the uterus. Next is anatomical relation. The ovary is bounded medially by the fallopian tube, lateral by the lateral pelvic wall, superiorly and anteriorly surrounded by the small intestines, inferiorly by the ovarian fossa, where the ureter and the internal iliac veins pass. Next is the histology of the ovary. The ovary is subdivided into cortex, medulla, and ileum. What is medulla? Medulla is a central core of the ovary surrounded by the cortex and continues with the ileum. It is formed of the connective tissues. Next is the cortex, the outer active part of the ovary that produces hormones and oocytes. It is formed of surface epithelium, cuboidal cells, germinal epithelium covering the free surface of the ovary. Next is the ileum. It is a site of attachment of mesovarian that carries blood vessels, nerves, lymphatics entering and leaving the ovary. So this is the ovary divided into medulla, cortex, and ileum. Can you see in this picture the mesovarian and the blood vessels, the follicular, the vesicular follicle, the zona pellucida, the ovulated oocyte developing corpus luteum, the medulla, the predominant follicles, the primary follicles, cortex, and then the secondary follicles. All this is given in the histopathology of the ovary. This is the cross section of the ovary. Next is the blood supply and the lymphatic supply. The blood supply, the arterial supply is through the ovarian artery, that arise from the aorta at the level of L2, and it passes through the infundopelvic ligament. Ovarian branch from the uterine artery, which anastomoses with the ovarian vessels at the broad ligament. And then the venous drainage. The ovarian veins accompany the arterial supply and join the plexus of the veins and the uterine vein. And the lymphatic drainage, it is the para-aortic via ovarian vessels. Next, the nerve supply. It is insensitive except the squeezing during the PV examination. The sympathetic and parasympathetic nerve, that is T11 and T10, are responsible to accompany the ovarian vessels. And next is the ovarian artery. Can you see clearly in this picture the ovarian artery and the vein that is corresponds to the ovaries? And next is the pelvic part of the ureter. The ureter is a narrow muscular tube about 25 centimeter in length. It runs predominantly from the kidney to the bladder. Next is the inlet. The ureter enters the pelvis above the bifurcation of the common iliac artery anterior to the sacroiliac joint. In the pelvis, it runs downwards, lying in front of the internal iliac artery. Next is the pelvic part of the ureter. At the base of the broad ligament, it runs medially and forward through the parametrium till it reaches about 1 centimeter lateral to the supravaginal cervix, where it passes below and at the right angle to the uterine artery. The ureter then passes forward through the ureteric canal in the upper part of the cardinal ligament, closely to the fornix, to enter the trigone of the urinary bladder. Next is the blood supply to the ureter. The branches, get the supply of blood supply from the branches of internal iliac artery, uterine artery, inferior vesical artery, and the vaginal artery. Next is uterine and cervical ligaments. It is through the broad ligament, round ligament, and the ovarian ligament. The broad ligament. The broad ligament is a double sheet of peritoneum that extends from the lateral wall of the uterus to the lateral pelvic wall. Its outer part forms the infundibulopelvic ligament in which the ovarian vessels transverse their way to the ovary. This is about the broad ligament. Next, what are the contents present in the broad ligament? There are round ligaments, ovarian vessels, uterine vessels, ureter, parametrial lymphatics and lymph nodes, sympathetic and parasympathetic nerves, parametrial pelvic cellular tissue, embryological remittance, hyoid cyst, Cobb's tubules, and Grantor ducts. All these are present in the broad ligament. Next is the round ligament. Round ligament is a microfibrous ligament attached to the uterine corona, runs downwards and forwards between the two lifts of the broad ligament to enter the linguinal canal via internal linguinal ring that comes out of the external linguinal ring to be inserted in the upper part of the labium meniscus. It pulls the uterus forward to keeping it in an anteverted and antefluxed position. Next is the ovarian ligament, the fibromuscular ligament that attaches the inner lower pole of the corona of the uterus. It plays no role, only the important role is the pelvic support to the uterus. Other than that, the ovarian ligament doesn't have any role in this uterus. Next is the cervical ligaments. The cervical ligaments are contents of thickening of the pelvic cellular tissue that lies between the pelvic peritoneum above and levator ani below and radiate outwards from the cervix to reach its pelvic wall. They act as a chief support to the uterus and the pelvic structures. Next is the three pairs of ligaments, that is, Necronens ligaments, the cardinal ligaments of the cervix, that spread out as on either side of the lateral surface, the cervix and the vagina. It is fan-shaped manner and it are inserted into the lateral pelvic wall. Uterocervical ligament from the cervix and the vagina backwards, supporting the rectum and below the uterocervical folds of peritoneum to become inserted in the third piece of the sacrum. Next is bulbocervical ligament extends from the anterior surface of the cervix and the vagina forwards beneath the bladder and surrounding the urethra to the posterior surface of the pubis. Next, the pelvic floor. All tissues lying between the pelvic cavity and the surface of the vulva and the perineum is called as the pelvic floor. It includes pelvic peritoneum, extraperitoneal fat, and the circular tissue, levator ani, their facial coats, the triangle ligaments, that is uterogenital diaphragm, the perineal muscles, and their aponeurosis, subcutaneous fascia, and the fat and the skin. All these are the pelvic floor, which is only the surface of the vulva and the perineum. Next is pelvic diaphragm. This is purely of the elevator ani muscles that covers the upper and the lower surface. In the middle, the pelvic floor is pierced by the ureter, vagina, and the rectum. The levator ani muscles, the scococcylus part, that is the origin from the ischial spine, inserted in the front of the coccyx. Next is the iliococcygis, origin from the white line on the lateral wall of the pelvis, inserted into the tip of the coccyx and the ragae. Next is the pubococcus, origin from the back and the pubic ramus, inserted into the tip of the coccyx and the ram. Can you see in this picture? This picture gives a clear examination about the pubococcus, puborectus, and iliococcygeal, and also with the relationship of the rectum to the coccyx. You can see in this picture clearly. Next is bulbococcygis. It sends fibers to the ureter, vagina, and the rectum, and bends with their intrinsic muscles described as pubouretus, pubovaginus, and puborectus. The perineum. This is the complete structure of the peritoneum, which shows the clitoris, ureter, bulbocarneolus muscle, vagina, perineum, and the anus. On the other side, you can see ischiocarneolus muscle, vestibular bulb, uterogenital diaphragm, superficial and transverse perineal muscles, bulborectus, and gluteus maximus muscles.